Hello, my name is Dr. Rajdeep Gaitonde, and I'm a cardiac electrophysiologist, and at this institution we do a variety of different procedures. I'll be explaining one of the procedures that you'll be getting done today, which is the placement of a pacemaker. And you might say, well, what experience do you have, Dr. Gaitonde? Well, on an annual basis, I do over 900 procedures a year, which is one of the top, if not the top, in the state of Kentucky. So you're in good hands. So your cardiologist felt that you required a pacemaker because you had symptoms of being tired, fatigued, just not feeling quite right, and having your heart rate low or forget to beat at times. So a pacemaker should fix that problem by making sure that your heart rate doesn't get too slow. So how do we put this pacemaker in? So you will be sedated. We call that conscious sedation. So what does that mean? Essentially, you'll be in a twilight type of setting. If you feel any pain, sir, just let us know, okay? Essentially sleeping, but not completely out. So you'll be resting quite comfortably. Once you're prepared, we start the procedure itself. Essentially what you do is I basically numb the area that we're going to implant, usually the left delta pectoral area right here. I numb it nicely with lidocaine, what you use in a dentist's office. Once you're nice and numb, I make a small incision and then I create a pocket where I'm going to place the pacemaker eventually. Underneath the clavicle, you have a vein. And through this vein, I get access and able to float a lead or a wire to the top chamber of the heart, then one to the bottom chamber of the heart. And then I attach those leads to the pacemaker, put the pacemaker in that pocket I just created, and then suture it up. 30 to 45 minutes later, we're all done with the procedure. So the next question is, what can I expect in the post-operative setting? Well, for the next 6 to 8 weeks, first of all, with the affected side, again, in most individuals, the left side, no heavy lifting, meaning nothing more than a gallon of milk. No raising the arm above the head or pulling. You can push down, move your arm to about 90 degrees. With your other side, you can do whatever you want. Now, it's normal to have a little soreness in this area, and that can persist for days to weeks. Your physician will also put you on antibiotics after the procedure and will arrange for you to have follow-up. From all of us, let me say thank you for trusting myself and the whole institution in your health care.